Hello everyone. This class will try to learn about hypoxia. Hypoxia is nothing but oxygen deficiency at the tissue, and it can be classified as hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, or it is also called as ischemic, and cytotoxic or histotoxic hypoxia. In hypoxic hypoxia, where the oxygenation of the blood is hampered, the oxygen fails to enter into the capillaries. Here, PO2 is very much reduced. The blood flow is normal, and oxygen carrying capacity is also normal. This type of hypoxia can be seen in case of high altitude, and it can be seen in case of lung disorders, where in case of fibrosis or interstitial lung disorder, or it can be because of hypoventilation, for example obstructive lung disorder, or it can be in case of cardiovascular diseases where there is a mixing of arterial blood with the venous blood. Anemic hypoxia, where the partial pressure of oxygen is normal, the blood flow is normal, but the oxygen carrying capacity of the blood is reduced because of the reduction in the hemoglobin itself or the abnormal hemoglobin. The abnormal hemoglobin can be methemoglobin and carbon monoxide poisoning, where they fails to deliver oxygen to the tissues. The third type of hypoxia is stagnant hypoxia. It occurs because of the stagnancy. Here, the partial pressure of oxygen is normal, the oxygen carrying capacity is normal, but the blood flow is reduced. The proximal tissue may not be hypoxic, but the distal tissue, obviously, utilization of all the oxygen, it becomes hypoxic. Some of the examples for stagnant hypoxia are the cardiac failure, or it can be severe vasospasm or thromboembolic disorders. Fourth type of hypoxia is cytotoxic or histotoxic. Here, partial pressure of oxygen is fine, the oxygen carrying capacity is fine, the blood flow rate is also fine, but the oxygen delivered to the tissue is not utilized by the tissue itself because of the defect in the oxidation process. And this, for example, it can happen in case of cyanide poisoning.